And here to tell us more about atrial fibrillation is Dr. Holly Phillips, a contributing editor for Prevention Magazine. Dr. Phillips, good to have you with us this morning.
Good morning.
If left untreated, what are the health dangers of AFib?
Well, you know, the top concern is actually stroke. Because atrial fibrillation causes the blood to move through the heart more slowly, it's liable to clot. A clot can then move up to the brain and cause a stroke. Other concerns would be heart failure because it causes the heart to actually work harder. But the key with all of this is to get diagnosed early before any of these things become a concern.
Diagnosed early, of course, you can treat it. Barry Manilow mentioned that his treatment that he uses, is that sort of the standard, or is it different for each person? How do you live with this?
Right. Well, you know, he described that sort of shock. He described it as paddles. That's called actually an electrocardioversion, where they use a defibrillator to actually shock the heart back to a normal rhythm. But there are other treatments, medications, surgery, or even an implantable pacemaker, or what we call an atrial defibrillator, is also used. Many people also just live with their atrial fibrillation while taking blood thinners perfectly well.
Some of the symptoms that Barry did talk about, are those common? Are they normal symptoms for people with this, or does it vary?
No, he described it spot on. Really, heart palpitations are the #1 symptom. You know, he described all of a sudden his heart went flub, flub, flub. Yep. But there's also fatigue, dizziness, and some shortness of breath. If you feel anything, get to the doctor.
Good advice as
Thank
always.
you,
Holly, thanks for coming in.